While mental health and its sometimes tragic consequences have been brought to the fore recently by many high-profile deaths in South Africa, importantly, mental health challenges are more prevalent, as it seems, according to statistics from a global study presented at the Mental Health Summit in Johannesburg in February 2018. Mental disorders have increased globally by 22.7%. In South Africa, 30% of people report lifelong psychiatric disorders, while 1 in 3 will be affected by a mental illness in their lifetime. According to the World Health Organization reports, 25% of the total world population suffers from mental and neurological disorder at some point in their lives. To discuss this now, we're joined by psychiatrist Dr Mvuyiso Talatala. Thank you very much for your time, Doc, on this Saturday evening. Are these statistics alarming for South Africa? I know over the past couple of months, everyone literally has been talking about issues of mental health, but this is nothing new in South Africa. Are we just seeing it and reporting it more?
Thanks, Griselda, for inviting me. The statistics are most likely accurate. It's just that maybe we have not paid attention to mental illnesses in the past.
Yeah.
That is why it's sort of shocking us now that we are seeing it on the news, but it's something that has been there all the decades, actually.
Is it getting any better or worse in South Africa? If we look at the current statistics, what we're saying in South Africa, 30% of people report lifelong psychiatric disorders, while 1 in 3 will be affected by a mental illness. Are we taking this serious enough as South Africans? I mean, over the past couple of months, almost everyone, I think all sparked, of course, by these high-profile incidents, have been talking about how they're struggling to deal with certain aspects of their lives and how they need help.
I think, Griselda, it will get worse before it gets better, because we have not exposed, we have not reached the depth of the problem. There's a lot of mental illness in our communities that is not exposed, that is not in the media. I mean, affecting the ordinary citizens.
Yeah.
So I think things will get worse before they get better. I think we are talking more about mental illness at this moment, at this stage, but I don't think we are doing enough. Mental illness is still underfunded. Even the programs of care are still not up to the level that will actually deal with the scourge of mental illness.
But why is it that way? I mean, things like, for example, the tragedy of the Life Esidimeni really cast a huge spotlight on how those who are in need of care in the mental health sector are not being given the adequate care. You're talking as well about underfunding pertaining to that. Why is it that we're sitting with situations like this before I can even get to issues of the home, for example?
There's competing priorities for the country. We can't fund everything all at once. So the country itself has its challenges. Health in general has many challenges that we all know of. But in addition to that, mental illness also suffers stigma.
That's right.
Stigma from the communities, stigma from the health providers, stigma from funders, government and schemes. So when people are funding mental health, there's that feeling that maybe I shouldn't be paying so much money for mental health. And this view may be held by the communities as well as funders, government and schemes.
How much of a role does stigma play? You know, I recall as well when all of this had been cast into the spotlight, many had spoken about, I could only speak perhaps for what would happen in some of, what would be within the black environment, home. When you go to an elder and say that, you're unwell, you're expecting one to be bleeding or you're expecting one to be faced with something else. But if you say, I do not feel well, I'm suffering from depression or any other ailment, it's almost as if you're told, go away, you don't know what you're talking about. How much of a role does that play in terms of people openly speaking about the challenges that they're facing, being unable to cope with the fast-paced nature of society, which could also lead to issues such as depression?
Stigma is still a big challenge for communities. You go and tell your manager that you saw Dr. Talatala, a psychiatrist, I'm suffering from depression. You are likely to suffer negative consequences because even employers, I'm going to leave our communities for now, even employers, people who are educated, still feel that you have to be strong, and if you've got depression or any of the mental illnesses, it's a sign of weakness. It's a sign that you can't cope. Imagine you are a board member and you tell your board that
you're seeing a psychiatrist.
I'm seeing a psychiatrist. There's still a whole lot of stigma in our communities. And yet, if that employer or that board would get that person supported and treated, they actually will provide much bigger value for the company. There's enough evidence to show that if we treat mental illnesses, the economy of companies of the country improves.
Absolutely. So we're failing as communities, we're failing as workplaces to deal with this particular aspect.
Absolutely, absolutely, we are failing. And part of it is that we've always treated illness as physical illness.
That's right.
You must cough.
I have to bleed, or I have to cough. Yes.
Absolutely. So it's actually difficult. In fact, human beings don't believe that their brains can be as sick as their lungs do. And yet they are all physical organs of the body, and they all are susceptible to illness. And if we treat them, you'll get much more value from the person.
I mean, you deal with the psychiatry, you know, I mean, from judging from what people have been putting out on social media and many other places as well, what can we do to help ourselves if we can't get to the likes of Dr. Talatala, for example? What can we do to cope with life, to cope with work? To cope with the fast-paced nature of life, just generally, that might lead to some of these aspects where we feel like we're just overwhelmed by everything.
All illnesses, including mental illnesses, the best is prevention. That is much...
Very interesting. Talk to me about that.
That is cheaper than treating the illness when you actually have the illness. And that starts from, firstly, being able to identify stressful situations, signs of mental illness, for instance, being able to pick them up, looking after ourselves, physical health, exercise, support for family members. If someone is in distress, it's exam time for high school students, for grade 12 learners, the support that you need there. So you must prevent it, but also pick the illnesses, the signs of the illness early.
And try to deal with that.
Try to deal
All
with
right.
it, yes.
Dr. Talatala, thank you so much for your time. I think we would need much more time to get into all of this. Perhaps we'd even be able to be helping someone who's dealing with some of those challenges out there. We've seen quite a lot of people come forward and talk about this, of course, because of those high-profile incidents that we've seen. Thanks for your time. Now, the SABC